Good morning, students. I am Dr. S.M. Jain, Professor in Microbiology. This is the last class of the Immunology. Welcome to the last class of Immunology. Good morning. I am going to present the last online class in front of you about the immunology, the hypersensitivity and autoimmunity. As I have mentioned in my early lectures, immunology is a very complicated system. But then when we look at the microbiology, on one side there are microorganisms and on another side there is a immune system. There is a tug of war between the two. If the immune system goes down, very down, then the disease and the death ensues. So we have to understand very well the immune system. Then hypersensitivity and autoimmunity are the two negative aspects of the immune system. Let us see what happens in the hypersensitivity and autoimmunity. I welcome all in this last lecture of the hypersensitivity and autoimmunity. I have tried to express this complexity of the immune response and its relation to other body components, tissues in a Hindi poetic manner. Say the inflammation, immune response, hypersensitivity, autoimmunity. These are all parts of the same cellulo-molecular system. So we know that the immune response is there, and by virtue of the immune response, we get the protection. But then the hypersensitivity is also there, autoimmunity is also there, because of which we get the tissue damage. So the शेर है कि inflammation, immune response, hypersensitivity, autoimmunity आदि सब एक ही थैली के चट्टे बट्टे हैं. कुछ की बदौलत दांत मजबूत तो कुछ के कारण दांत खट्टे हैं. Just to give you a summary of the immunity and the immune system, immunity is an abstract outcome of the overall powers of the body to prevent microbial and other injuries. We already know that there are two types of the immunity, acquired immunity and innate immunity. So innate immunity, what is innate immunity? Innate immunity is a very general defense achieved by the body due to physical and cellular structures, chemical and certain special molecules, phagocytes and NK cells. So the combined effect of all these three components uh, give rise to a innate general immunity, non-specific immunity to the body. And on the other side, there is a specific immunity or acquired immunity, which refers to outcome of a well-organized system of various organs, cells and molecules. A simple question is frequently asked: what are the functions of the immune system, or you can say activities of the immune system? So we can summarize the functions in the four things. Number one, it protects. It protects the body from invading microorganisms. Number two, it is responsible for the hypersensitivity. Then because of the immune system only, we have got autoimmunity. And the fourth thing is that the immune system constantly does the surveillance and protects against the cancer. Now we will see the hypersensitivity in the little detail. What is hypersensitivity? Initially, immune system originally was considered to be a protective process, but later it was seen that at times it may be injurious. Some individuals' immune system responds inappropriately in an exaggerated manner, usually against an innocuous antigen, leading to tissue damage, disease, or even death. This is known as hypersensitivity. So here we can see that some individual, not all people get hypersensitivity of that for that particular substance. Number two, inappropriately exaggerated response. This is second thing. And the third thing, important thing, is that innocuous antigens, the antigens which are otherwise harmless, against them the exaggerated response is mounted, and this is hypersensitivity. We can understand from the word also hypersensitivity. कोई आपके गाल पे एक थप्पड़ मारे तो आप नॉर्मली क्या करोगे, आप भी एक थप्पड़ जड़ दोगे, लेकिन कोई आपके गाल पे एक थप्पड़ मारे और बदले में आप 10 थप्पड़ मारो तो कोई भी बोलेगा पागल है साला. Say in hypersensitivity, the first thing is that it is after the first exposure. This is also known as sensitizing dose or shocking dose. Without the first exposure, the hypersensitivity cannot be there. So whatever it is, from whatever means the exposure is there, depending upon the lapse the time between the antigen exposure and response, hypersensitivities can be divided by into immediate or delayed. Earlier, this was the only classification. Then later on, GELL and COOMBS, they classified into four manners, four types, depending upon the mechanism of the hypersensitivity operative. So there is a immediate hypersensitivity which is classified into three types, and there is a delayed hypersensitivity. So some things about the immediate hypersensitivity reactions. The criteria is that it occurs within few minutes to few hours of antigen contact. And this is further classified into three types: type 1, type 2, and type 3. So the total number is type 1, type 2, type 3, and type 4 hypersensitivities. In contrast to the immediate hypersensitivity, the delayed hypersensitivity occurs a few days of the antigen contact. And this is because of this cell-mediated immune response. And this is also known as type 4 hypersensitivity reaction. This classification is given in a tabulated manner. The properties of the hypersensitivity types is given in tabulated manner. Say for example, the types of the immune response, altered type of immune response. Here in first three, the type 1, 2, and 3, it is humoral. Humoral means antibody mediated. And type 4 is cell mediated. Immediate or delayed character, the first three are immediate and the last one is the delayed. Then duration between the appropriate symptoms and antigen contact. The type 1 is between 2 minutes to 30 minutes. Then type 2 is 5 to 8 hours. And type 3 is 2 to 8 hours. And type 4 is 24 to 72 hours. So that is why they are primarily classified into immediate and delayed hypersensitivity. Other differences, the antigen in type 1 is soluble, type 2 it is cell surface bound, type 3 it is soluble, and type 4 it is soluble or bound. And like that there are many detailed characters between the four. If you want more, you can delve into these details. Otherwise, just know that the many aspects of these types of the hypersensitivities are different. This part of the table gives about the clinical manifestations. So what manifestations are there? So type 1 is more rapidly occurring, and the number one is the anaphylaxis. Anaphylaxis is a serious medical emergency. Then asthma, everyone is well versed. Then atopic dermatitis, transfusion reaction, and hemolytic anemia, RH, this is in type 2. And type 3, Arthur's reaction, serum sickness, etc. And the tuberculin test and granuloma formation, tuberculosis, leprosy, etc. It is in the type 4. Little detail about type 1 hypersensitivity. The most important things are in this type of hypersensitivity that in this there is production of IgE antibodies. You already know that there are 5 types of the antibodies: IgA, IgG, IgM, IgD, IgE. So IgE, this type of antibody is responsible for the uh, parasitological immunity and the hypersensitivity. So B cells synthesize IgE after the contact with the allergen, and this IgE leads to mast cell degranulation. Mast cells are the special type of the basophils which are stabilized in the tissues. So, say for example, lung epithelium, the mast cells are there, already there. They are loaded with the IgE, and then they will degranulate. We will see the mechanism later on. So, this kind of reaction, this kind of mechanism leads to localized response, which is known as atopy, or the systemic response, which is known as anaphylaxis. This systematic diagram expresses the whole mechanism of the type 1 hypersensitivity. First there is exposure, then re-exposure of the allergen, and then primary and secondary chain of events leading to various signs symptoms mediated by the immune cells and cytokines. So let us see what happens here. Say the allergen, the so-called allergen comes into the body contact. This allergen or the antigen is identified and engulfed by the APC. APC means antigen presenting cell. This antigen presenting cell processes and then presents the antigen to the T cell, the Th2 cell, and this cell in turn stimulates the B cells. The B cells divide, they go under the metastasis process, the proliferation process, and some become memory cells and the other convert into plasma cells. Plasma cell is a factory of the production of the antibodies. This plasma cell produces these IgE antibodies. These antibodies go to the mast cells, and the Fc portion of the antibodies, they attach to the mast cell receptors, and this is a ready bomb. This is a ready bomb to produce the anaphylactic shock or the hypersensitivity reaction. When the antigen on second time comes in contact with these mast cells, and when the two FAB portion, the antigen binding portion, attaches together to the antigen, this leads to degranulation. You can see the granules coming out of the mast cell, and these granules contain many primary and secondary mediators of the inflammation. And because of these inflammatory chemicals, smooth muscle contraction is there, blood vessel dilation is there, platelet degranulation is there, and there is sensory nerve ending excitation is there, and the eosinophils also increase. So this whole set of biological effector mechanisms operate after this mechanism of the hypersensitivity, and this can lead to various signs and symptoms depending upon the severity of the hypersensitivity reaction. These are some of the substances which can trigger the type 1 hypersensitive reaction. You can see they are so trivial type of the substances or innocuous antigens, harmless antigens. Nuts, eggs, peas, seafood, beans, milk, and so on. These all things can induce. You can see they are all uh, some are of course poisonous things like the venom of the bee, wasp, and they can really lead to a serious emergency of the medicine. The factors influencing type 1 hypersensitivity. we have already seen that not much is known about the hypersensitivity except the process. So the three things you can count to influence the process. One is genetic makeup. Some people are genetically susceptible, some are not. Then the allergen dose. Allergen dose has got a definite impact on the type of the immune response produced. In the second dose, if it is very, very high, then it may be very high hypersensitivity response. Then Th1 and Th2 response. These two responses, they regulate the balance between the antibody and cell mediated immune process. So this dysregulation of this process may also be responsible. How do we detect or diagnose type 1 hypersensitivity? There are many tests which have come up recently because there are many patients who are suffering from the hypersensitivity disease. So many tests have been devised. So one is skin prick test. Many known allergens are tested on the skin of the patient. Then there is a radio immunosorbent test, RIST. Then there is a radioallergenosorbent test, RAST. These all tests, they diagnose different types of the antigen to which the hypersensitivity reaction is there. This is the skin prick test. You can see this is the negative control, and here is a injection of seafood. There is a stamine. There is a egg, house dust. This is the egg. So many antigens are subcutaneously introduced into the skin, mostly of the forearm, and then the reaction, local reaction is seen. Treatment of type 1 hypersensitivity. Number one, avoidance of known allergen, hyposensitization, monoclonal anti-IgE, and drugs when symptoms are there like antihistamines, epinephrine, cortisone, theophylline, and cromolyn sodium. Then the second type of hypersensitivity, type 2 reaction. In this case, host injury is mediated by antibodies. They are mostly IgA or rarely it can be IgM. And these antibodies, they react with various antigens such as host cell surface antigen, extracellular matrix antigen, exogenous antigens absorbed on host cell. For example, a drug coating on RBC membrane. There are three mechanisms of type 2 hypersensitivity manifestation. Number one, antibody, the Fc portion of the antibody, activating complement system. Number two, antibody, again Fc portion, interacting with Fc receptor on target cell. And number third is autoantibody mediated antibody dependent cellular dysfunction, or also known as ADCD. So we can see here in this diagram, when the Fc portion activates complement system, then there is complement activation, and there is lysis of the RBCs by complement mediation. There is a list of the type 2 hypersensitivity mediated clinical conditions like transfusion reaction, erythroblastosis fetalis, that is Rh incompatibility, autoimmune hemolytic anemia, agranulocytosis or thrombocytopenia, drug-induced hemolytic anemia, and pemphigus vulgaris. Second mechanism is that the Fc portion of the antibody interacts with the Fc receptor on the target cell. You can see here this is the target cell, and these antibodies are attached to the target cell, and by the NK cells the target cells are killed. The third mechanism where FC portion of the antibody interacts with the FC receptor on the target cell. In ADCC, antibody-dependent cellular cytotoxicity, this is involved in the destruction of the targets that are too large to be phagocytosed. For example, parasites, tumor, or graft rejections. Another mechanism is opsonization. Through Fc receptors of certain antibodies, the phagocytes are linked to the antigen on the target cells. By this bridge, the target cell can be engulfed and destroyed by the phagocytes. Still another route of type 2 hypersensitivity is ADCC, antibody-dependent cellular dysfunction. Here, the host produces certain antibodies which bind and disturb the normal function of the human self-antigen. These antibodies may be directed against human receptors, resulting in activation of the receptor, for example, which happens in Graves' disease, or inhibition of the receptor, which happens in the myasthenia gravis. Then the type 3 hypersensitivity. In type 3 hypersensitivity, which is also known as immune complex disease, where the excess immune complexes, that is antibody complexes, they initiate inflammatory response through activation of complement system. And antigen complexes can involve various types of antigen, which may be exogenous of bacteria, virus, or endogenous such as of DNA. In normal removal of immune complexes from the body, the immune complexes are rapidly cleared by activation of complement system. The immune complexes coated with complements are either directly phagocytosed by macrophages, monocytes, or are bound to RBCs and carried to the liver and spleen where they are phagocytosed. Soluble versus insoluble immune complexes. The balance between level of antigen and antibody decide the nature of immune complex. And if the immune complex is small, it percolates in the body and deposited at various sites, leading to generalized type of type 3 reaction. The mechanism of the tissue injury by classical complement activation. The antigen antibody complexes stimulate the classical pathway of complement, and the products of which mediate the tissue injury. They are anaphylatoxins, chemoattractants. The neutrophils fail to phagocytose large immune complexes, and then there is a reaction. The tissue injury is mediated by the platelet activation also, where the immune complexes bind to the Fc receptor on platelets, leading to their activation. And platelet aggregation leads to ischemia, and ischemia leads to further damage of the tissue. Activation of the HAGEMAN factor is also there, and there is leading that leads to vasodilation and edema. The type 3 reaction can be localized or generalized. The localized reaction is known as Arthus reaction, where there is a localized area of tissue necrosis due to vasculitis resulting from acute immune complex deposition at the site of inoculation of antigen. Farmer's lung and the bird Facier's disease are the example of Arthus reaction, where there is intrapulmonary lesions produced due to the inhalation of the bacteria, fungi, spores, or proteins. In generalized or systemic type 3 reaction, there is formation of small sized soluble antigen antibody complexes. These deposit in the various tissues, and where they initiate inflammatory reaction like vasculitis, glomerulonephritis, or arthritis may result. This is a pictorial representation of the deposition of the antigen antibody complex and the resultant inflammation. Lot many diseases are thought to be mediated by the type 3 hypersensitivity reaction. For example, systemic lupus erythematosus, rheumatoid arthritis, parasitic diseases resulting from immune complex deposition, etc., etc. Serum sickness term is little self-explanatory. When the serum as a therapy is given, for example, horse anti-tetanus serum, and these injections they lead to formation of a large number of immune complexes, and typically after 7 to 8 days, individuals begin to show various manifestations, and this is collectively known as serum sickness. Then the fourth type, or the delayed hypersensitivity reaction. Uh, this type of reaction differs in other reactions in the manner that it is delayed. It occurs after 48 to 72 hours of antigen exposure. It is cell mediated. Characteristic cells called TDTH cells, that is the delayed hypersensitivity T cells, are the principal mediators in this. And the tissue injury occurs predominantly due to activated macrophages. The operative principle of the mechanism of type 4 reaction can be seen in two stages, sensitization phase and if this is the schematic diagram of the mechanism. Initially the TDH cells become activated and then they activate the macrophages. Normally the DTH response leads to clearance of the pathogen with very little tissue damage. But when the organism escapes the phagocytes, the tissue destruction increases, and it is difficult, since it is difficult to eliminate the organism, the macrophages are activated. The tuberculosis, the tubercle in the disease tuberculosis is the classical example of the DTH reaction, where this tubercle central area of cageation with multinucleated giant cells and then epithelioid cells and lymphocytes. This is a classical histopathological picture of the tubercle seen in the tuberculosis. You must have heard about the tuberculin test or Monto's test. It is a classical example of the delayed hypersensitivity. In sensitized individuals, that is who possess sensitized TDH cells due to prior contact with Mycobacterium tuberculosis, when a preparation of tuberculin antigen, an extract of M. tuberculosis, is injected intradermally, local reaction develops after 48 to 72 hours, consisting of induration surrounded by erythema. And if it is more than 10 mm, it is declared as positive. In contact dermatitis, many antigens such as nickel, poison oak, etc. act by DTH response. They are absorbed from the surface and they produce hypersensitivity type 4 lesions. This is a list of the antigens which can give rise to DTH reaction or hypersensitivity reaction type 4. Intracellular bacteria like Mycobacterium leprosy, tuberculosis, intracellular fungi like Pneumocystis jirovecii, Candida albicans, intracellular viruses like herpes simplex virus, variola virus. Skin test also show hypersensitivity reaction like tuberculin test, lepromin test, etc. Other conditions, there are non-infectious conditions also like diabetes mellitus type 1, multiple sclerosis, and lepra reaction 1. These are the examples where type 4 hypersensitivity reaction is operative. Now, few words about autoimmunity. Autoimmunity is a paradoxical term in the sense autoimmunity should actually literally means that the immunity for the self, but here the actual meaning is that the self tissue is destroyed by the immune system. So the immune response is misdirected. That occurs when the immune system goes RE and attacks the body itself. So we have already seen that the definition, the name is little paradoxical. So if the immune system damages our own body system, body tissue, then it is known as autoimmunity. There is a long list of diseases which are thought to be of autoimmune origin. Some 80 diseases list is there where the autoimmune mechanism is thought to be operated. Autoimmune diseases are difficult to diagnose. The patient suffers for a long period and then he gets the diagnosis and gets the treatment. Most of the autoimmune diseases, the corticosteroids are given. So this is the just a picture to represent the list of the autoimmune diseases. We are so awesome, even our own immune systems cannot get enough of us. हम उम्र भर हम दूसरों को ही पटाते रहे, हम खुद ही खुद से ना पटे. The body damage and other observations were described by Paul Ehrlich, and he introduced the term horror autotoxicus, which means horror to autotoxicity, meaning body's innate aversion to immunological self-destruction. Usually, the immune system does not react to its own antigen, and this non-reactiveness is known as tolerance. And if there is any breach, any damage to this tolerance mechanism, then several autoimmune disease can start. This immunological tolerance can be defined as a state in which an individual is incapable of developing an immune response against its own tissue antigens. And there are two broad mechanisms: central tolerance and peripheral tolerance. To understand the central tolerance, we should go back into the structure of the immune system and basic functioning. We have got T lymphocytes and we have got B lymphocytes. T lymphocytes mature in the lymphoid, the thymus, and the B lymphocyte develop in the bone marrow. So the cells which are responding to the self antigen in thymus, they are inhibited or they are destroyed, and the same happens into the bone marrow. These are inhibited. These these are either negatively selected or their receptors are changed by the genetic recombination. So central tolerance, we should understand that centrally the cells which are primarily mounting the immune response, they are destroyed, who are responding to self antigen. Peripheral tolerance mechanisms are operative through various mechanisms uh, like ignorance, energy, phenotypic skewing, apoptosis by AICD, activation induced cell death. Regulatory T cells, T reg cells are involved in peripheral tolerance. Then dendritic cells may also be involved. Then sequestration of the self antigen may be operative at times. The autoimmunity operates by breaches in various areas of the tolerance, like breakdown of cell energy, failure of AIDC, loss of T regulatory cells, providing T cells help to stimulate self-reacting B cells, release of sequestered antigen. For example, the antigen which was which were never exposed to the immune system releases by some reason, like spermatozoa antigen or the lenticular eye lens antigen, which is otherwise not coming into the contact of the immune system. Then molecular mimicry may be there. The microorganisms, some microorganisms share the antigenic determinants with the body's antigen. So the immune system confuses, and the outside molecule of the microbes, which is similar to the body's molecule, excites the immune response and the body is attacked. Like in rheumatic fever, the antigen on the streptococcus is similar to antigen on heart muscle. Then polyclonal lymphocyte activation. Superantigens released from microbes, for example Staph aureus, polyclonally activate the T cells directly by binding to antigen non-specific beta region of T cell receptors. Polyclonal activation can be induced by products of various microbes such as Epstein-Barr virus. Then there may be bystander activation, non-specific activation of bystander self-reactive Th1 cells. They lead to cytokine influx, which cause an increased infiltration of various T cells specific at the site of infection. There is a long list of the autoimmune diseases where various mechanisms are suspected to be operative belonging to the autoimmune diseases. As I have said earlier, there are some 80 diseases or so. Hashimoto thyroiditis, post-streptococcal glomerulonephritis, systemic lupus erythematosus, rheumatoid arthritis, Sjogren syndrome, scleroderma, seronegative spondyloarthropathies, multiple sclerosis. The laboratory diagnosis of autoimmune diseases is done by a combination of the biochemical markers and the histopathology. For example, autoimmune hemolytic anemias can be diagnosed by COOMBS test. Gold-Pasture syndrome can be diagnosed by the biopsies from patients which are stained by fluorescent level anti-IgG. Histochemistry is done. So likewise, there are very many mechanisms of multiple mechanisms for diagnosis. All in the end, I would like to sum up my presentation with the note that the body is not eternal. So many things, environmental and genetic and other things are operative in a negative manner. Immune system is also not eternal. So that is why there are various self-destructive mechanisms like cancer and autoimmune diseases and so many other diseases are there where the the system which has taken birth gets the destruction by various means. Say creation, operation and destruction are the three streams which go on. So there has to be some mechanism to effect the destruction. So these autoimmune diseases are one of the destructive forces, destructive mechanisms of the human body, or for that matter any other creature. Thank you very much.